Hexalen is used to treat ovarian cancer in adults. Hexalen belongs to a group of drugs called alkylating agents, which lower stop cancer cell growth. Hexalen capsules contain saltretamine as an active ingredient. Hexalen capsules works by exciting its psychotoxic effect. How to use? Hexalen is usually taken 4 times per day. Follow directions on a prescription label. Don't take this medicine in larger or small amounts or for longer than recommended. Hexalen is given in a 28-day treatment cycle, and you may only need to take this medicine during the first 2 or 3 weeks of each cycle. Your doctor will determine how long to treat you with Hexalen. Take Hexalen after meals and at bedtime, unless your doctor tells you otherwise. Hexalen can lower blood cells that help your body fight infections and help your blood to clot. Your blood will need to be tested often. Your cancer treatments may be delayed based on the results of these tests. Your nerve and muscle function may also need to be checked. Contraindications. Hexalen capsules is contraindicated in patients who have shown hypersensitivity to it. Hexalen should not be employed in patients with pre-existing severe bone marrow depression or severe neurologic toxicity. Hexalen has been administered safely, however, to patients heavily pretreated with cisplatin and/or alkylating agents, including patients with pre-existing cisplatin neuropathies. Careful monitoring of neurologic function in these patients is essential. Warnings. Medicines can interact with certain foods. In some cases, this may be harmful and your doctor may advise you to avoid certain foods. In the case of Hexalen, there are no specific foods that you must exclude from your diet when receiving Hexalen. Tell a doctor if you are pregnant or plan to become pregnant. Before using Hexalen capsule, inform a doctor about your current list of medications, over-the-counter products, vitamins, herbal supplements, etc., allergies, pre-existing diseases, and current health conditions, pregnancy, upcoming surgery, etc. Some health conditions may make you more susceptible to the side effects of the drug. Side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Stop using alkylating and call a doctor at once if you have severe numbness, tingling, or cold feeling in your hands or feet, severe or continuous vomiting, fever, chills, flu symptoms, mouth sores, pale skin, easy bruising or bleeding, unusual weakness, a lightheaded feeling like you might pass out, severe dizziness or spinning sensation, seizure, convulsions, or upper stomach pain, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes. Common side effects may include mild nausea or vomiting, mild numbness or tingling, loss of appetite, mood changes, mild dizziness, or skin rash, itching, hair loss.